where government can come in to finish. Where CHAG, that Ayeboa is here, the Christian Health Association of Ghana, they are our partners. We are not into competition with them. Can you also come in to pick some of them, finish, equip, and run? The private sector, where do you come in? So we are planning a lot of thoughts going into this.
We are planning. We are planning.
We are planning.
Anyway,
you add the other one.
No, I don't want to add that one. I don't want to borrow that one. That we are planning is enough.
We are planning is enough.
The National Free Primary Healthcare Launch will be happening today at Dodowa District Hospital. Shai Osidoku will be having the President in attendance, His Excellency John Dramani Mahama will be there. So we'll be crossing over to join our man on the ground. That's Jude Duncan will be joining us to tell us what is happening on the ground. Right after that, we bounce into the studios again, have this more conversation. But what is this we are planning thing? If he doesn't say that, he can't talk. Is it a usual policy?
Let's say that they are planning so that they can build. It's not like they will start the building and, as the Bible will say, some judge. Which one of you, when they want to build, will not sit down and plan, consider the cost of the building,
that is
to know if they can complete it. So he's saying that they are planning to know whether they can finish. They don't want to start something they can't finish.
Hey!
Politics.
Oh, no. So, like we said, exactly 6 minutes from now, I'll be crossing over. What do you make of this Wale youth issues and lockup of the coordinating director's office amidst protests? What is happening?
It's because when people did that in the past, they were not punished well. Yes, because when I know that this thing that I'm going to do, somebody did that and was severely punished, I will advise myself. What kind of impunity is this? You get up. Who gave you that right to go and lock up an office? If you think that somebody is not performing, there is a right way to go about it. You petition the appropriate quarters. You don't go locking up offices. What kind of AE is that? I mean, let's move beyond. Somebody did it in the past. We criticized it. So it cannot be right. It cannot be right. So who determines who is performing? Are you the one who appointed the person? The president appointed the person. If the president thinks that the person is not performing, it is the right of the president to fire the person, not you going to lock an office. I mean, what kind of AE is that? Let's leave this kind of chuchu blamer attitude behind and start doing proper democracy. What is that?
Are you saying that this was very proper?
Oh, I mean, how can so somebody will just get up, go and lock up an office that the MC is not performing or the director is not performing?
He doesn't come to work. He's always absent.
If he's not coming to work, what's the right thing for you to do? You don't have that right to go and lock up a state office.
His office was incompetent as you just were and as a channel.
As a channel, no,
Tiwi.
Oni near what bit media age, man.
It's ongot Tinefie.
What Tinefie?
I'm the tower gate. I mean,
so major man.
And I was any proper democracy.
Oh, any proper democracy.
Yeah, democracy better.
Democracy, say, who say, oh, a bankrupt penny or one person so, and a director on your dear no, no for quine panel so, no actual, or MC, boy, your friends say, or MP, about MP amania. I send a petition. So get a group of people, sign a petition for come your friends, a chief of staff. So one you and I say direct friends, a regional say MC, you know. So say or say regional minister say. Say Lindo Klu or money MC for our greater Accra. No, MC no so will be or senase. Say wale MC Hoyer Northeast or Sapa East. Inti for Coco regional minister. So wo nipa we o hey o wale onyade o medjuma ntem ono a ye hwe no a ejuma no ntimi nye
medjuma ntem to de bi so mba e na ono so awabon
nti troko
jinedi
aha
na ye mpa no yeah
na so be sorry na akotu ni office mu de
obi shase obi pe
o na say no de obi pe kra de wakose memuru na ase
somewhere sir
into so wakoye san ye chewa
obi shase for me some of these things when it start happening you know
politics politics
you know where it's coming from but I think that it's not fair to go on this tangent. Well, the president is set to officially launch the country's flagship free primary healthcare program, a major policy initiative designed to expand access to primary healthcare across the country. The program will be launched today at 10 a.m. at Shai Osidoku District Hospital in the Greater Accra region. So we will be talking to our man on the ground to find out how far we're preparing. But the program itself will take off at 10 a.m.
I have some questions.
Okay, ask me the question. You want to ask me or want to ask the viewers?
I want to ask you, the viewers, the president, everybody.
You want to ask the president?
But I'm also afraid that if I ask the question, people will say I'm not informed. But I want to accept that I'm not informed. Does it mean that when this program is launched or comes into effect, why are you laughing? Yeah, I want to be informed. Ask. Yeah. Does it mean that when the free primary healthcare comes into effect, it is going to replace the national health insurance? So what will be the difference? Because we need a Ghana card. So it means that if I have my Ghana card, I can go to the hospital and I'll be taken care of, whether I'm enrolled on national health insurance or not. Is that what it means? And if it is not coming to replace the national health insurance, what are some of the conditions that will fall under the free primary health care, and which ones would have to go under national health insurance? Is that not? I want to understand the entire policy, so that I know what to do, whether to carry my Ghana card or carry my national health insurance card. Well, I know that a Ghana card insurance, they have infused it in the Ghana card.
Everything is now being infused into.
Does it mean that I don't have to register for or renew my Ghana NHIE when it expires?
You need to renew it.
So what is the distinction? What is the difference?
Okay, so now almost all the cards, if you realize at the point of registering, your cards were captured.
Yeah.
Okay.
Yeah.
So that it will be synced with one name, one ID number. So that's the rationale. So you carry only one card that has all the cards.
Yeah.
So you can renew it with that number, your national ID number.
Yeah.
So your NHIS is in there, your SNIT, your TIN, your tax, whatever, everything is in there. That's one point. Now you were asking why the launch today by the president to officially introduce a new health policy program, which is aimed at making basic primary health care free for citizens. Now, when we say free primary health care, it refers to a system where people can access basic health services without paying at the point of use.
Without paying?
Yes, basic health services.
Like?
A general outpatient care, OPD, visit, treatment of common illness like malaria infections, fever, maternal and child health services, basic vaccinations, and community health services. They all fall under the primary, the free primary health care.
So I know that these
are basic things.
So these things that you mentioned, previously they were captured under the national health insurance.
Yes.
So, for instance, if assuming as I sit here, my national health insurance has expired, I have not renewed, and this free primary health care comes into effect, I can go to Lekma Polyclinic and be treated.
Be treated.
And I don't have insurance.
You don't have to pay anything.
Okay.
So what it means is this: we have a situation whereby people there's an emergency and then they want to take your vitals before. They want you to pay something before
those things will be done. So once this thing comes into effect, all those things
will be catered for.
Okay.
So if there's an emergency, you get there, they quickly have to take care of you.
Okay.
Make sure. I mean, those basic things need to be taken care of. You reduces financial burdens on families. It also improves access to health care. People can walk into the hospitals and get treated, especially in rural areas. So the focus is the rural and the peri-urban areas, so that people can walk in, go get their health screen, encourage early treatment, like preventive serious illness, where we have this issue about 42-45% of non-communicable diseases are killing people. Now you can walk in and do those checks for free.
Those checks will be done for free.
I mean, go check your BPs and stuff like that to get to know your status. It helps to strengthen the basic health system. This policy, that is the rationale for it, not that cash and carry thing.
So that everyone, including the poorest of the poor, can access at least some level of
health care.
Okay.
I mean, it's already the National Health Insurance has this free primary health care initiative, like expanding free access to beyond the NHIS limits. So basically, this is what it goes. So you may have the NHIS, but this is like an additional, expanded the limits that the NHIS can give you, or targeting basic care at the community levels, and also removing some co-payments, and barriers at the primary facilities.
Okay.
With this coming in, you are not going to pay that. You need to walk away, go there, go check your asses, do everything. So it simply means you should be able to walk into a basic clinic and treatment without paying at the point of service.
So what then would be the motivation for me to renew or register for National Health Insurance if I can access?
You may never know, because there are some basic, like dialysis, those ones, the basic, free basic
will not cover those.
Will not cover those ones.
Okay.
They made it as the very basic. The target is not the urban. The target is the rural.
Okay.
And some peri-urban areas.
Okay.
That's supposed to be the target.
Okay.
So it's important for everybody to get to know that the NHIA has certain limits.
Okay.
Now, sometimes you go to some place, they'll tell you, go do this, you have to pay for it. But with this, you don't need to pay for it. Okay. So the president will do the launch. PCR, if you're ready, we can put Duncan on, and then we have this conversation with him to find out how far with preparation at that level. Jude Duncan. So for those of you out there, the lunch will be done today, 10 a.m. The initiative is expected to address the gap in access to basic and immediate healthcare services, especially at the community level.
At the community level. Okay, so it means that I should not say that because of free primary healthcare, I won't do my national health insurance. I still have to do it.
You still have to do it. You still have to renew.
The primary healthcare is for basic stuff.
Basic stuff.
Okay.
The long queues, the delays in hospitals. I mean, this is coming to close those gaps. I mean, out of pocket payment at the point of care, limited access to a nearby primary health facilities in the rural areas, also weak preventive healthcare. People only go to hospital when they are seriously ill. But now, if you are feeling some feverish, you can walk in. Be taken care of free.
Okay.
So that you can. So the aim is to make basic treatment easier, faster, and more affordable at the first point of contact.
Okay.
Yeah, that is what it seems to do. It's a key policy. I mean, the National Health Insurance. So this is more or less coming to complement the NHIS by covering services the NHIS does not fully handle.
Okay.
My only Yeah, my only worry is that that it shouldn't create this overlap and duplication of roles. So it has to be clearly defined between the NHIS and this one coming in. It may also increase pressure on the NHIS funded. Definitely it will do that because facilities, more people seek free services. Okay. Now it could force policy restructuring of the NHIS benefit and also the funding model. This one, okay, so they have to take a second look at the NHIS again. The biggest issue is clarity of coordination between the NHIS and the new initiative. There should be that clarity. I think that has always been our problem. We don't clarify what we want to do. Because if you look at the financial needs in our health sector, Ghana health sector already faces funding constraint. Now, NHIS itself has experienced delay in when it comes to investment to the people. The rising cost of healthcare delivery, drugs, staff, equipment, etc., and also the competing national priorities, debt and infrastructure and wages. But a strong political commitment could unlock the donor support.
So government is taking the cost of this entirely. So if I am a private individual and I want to support,
you can support.
Is there a way to donate? Because I know for Mahama Cares,
there's this the care that is referred to as Mahama Care, so you can donate to it.
Ghana Medical Trust Fund. Yes, for that one I know there is a fund that you can donate. But for this one,
so this ones all will feed into that. Will feed into the medical trust fund.
Do we have the capacity? Because I know that, as you just mentioned, even for NHIS, there are times that reimbursements becomes a problem. Is it? Do we have the financial muscle?
No. So this is what is going to happen once we get committed to it. It will unlock some donor supports. We have donors who really want to support some primary health care, but we didn't have that platform. And so there's an opportunity for them to donate to support this. But because the efficient primary health care is cheaper than hospital care in the long run, we have efficient primary health care.
Yeah,
it will be cheaper because this is more like preventives.
Yeah,
this will help with that preventive, that communicable diseases that people. I'm not feeling fine, but I don't have the money to go to the hospital. With this one, you can go to the hospital, you can be checked, and then you walk away freely. Government will be built to pay. Now let's go to Dodowa, Shai Osidoku district, and speak to our correspondent at the area, Jude Duncan. Good morning.
Good morning, El. How are you?
I'm fine by His grace. How are you too?
I'm doing great. I'm doing great by the grace of God. I'm doing great.
I know you find yourself in Dodowa, where the launch of the free primary health care will be taking place 10 a.m. The president will be there. How far with preparation, and what more can you tell us?
Yeah, thank you very much. Yes, it is true that today is the official launch of the free primary health care, which was promised by the President of the Republic of Ghana, His Excellency John Dramani Mahama, during the 2024, campaigns. And today, the official launch is coming on. And the video I sent to you, looking at it, it means all is set for this very historic occasion for our health delivery in the country. So all is said, we are waiting for the dignitaries to report. The media houses are here, the Ghana Health Services, and then the Ministry of Health. And not long ago, I saw the Health Minister, Honorable Mita Akando, and other dignitaries that are thronging here for this very historic occasion. So this is what is really happening here at the moment. All is set for the launch of the free primary healthcare promised by the President of the Republic of Ghana, His Excellency John Dramani Mahama, and then the NDC as well.
Well, I will try to get proceedings up. But tell us, is there anybody there apart from those you were expecting to arrive that we can speak with? And is the MC there? Is there anybody from the coordinating council we can talk with?
Yeah, definitely. We have a lot of dignitaries that are coming. This is a national something, so organization and everything is perfect. People are joining. The regional minister who lobbied for this very program to be launched in the Shai Osidoku constituency. You remember the Shai Osidoku District Hospital was built by His Excellency John Dramani Mahama. He built that particular hospital in 2016 before he left office, and then he came back. So as he promised to bring us the free healthcare, I mean, the dream is fixed that the minister said it will be prudent for them to have it launched at Dodowa so that, I mean, it will signify the whole thing. So the regional minister, Honorable Linda Okluakwele, I mean, is personally representing, and then traditional rulers from the Shai Osidoku district are also coming. And then let me say the Greater Accra region, dignitaries are coming, the health ministry, and then, donor partners are all coming for this very wonderful and an august occasion today.
All right, Jude, I'll follow proceedings and whatever comes up, you bring it up to speed with it.
Okay. I'll send you everything as soon as we, touch down.
All right, thank you so much for talking to us.
You're welcome. Okay.
That's our reporter on at the grounds at Dodowa, where the lunch will be taking place 10 a.m. We know is the time. The National